So if they have a conductive hearing loss, then the bone sound is going to be longer than the air, which is reversed. Okay? So if they have sensory neural hearing loss, then the air conduction is going to be heard longer, but less than a 2-to-1 ratio. And then basically you're doing something to check and see whether they can hear. So you're testing your auditory acuity, and you're basically rubbing your fingers together like this, and you ask them if they can hear it, and check over here. Or you can, whisper or something like that. And then you're going to check, and you start closer to the ear like this. You're rubbing the fingers, and then you ask them to tell you when they can't hear you. So obviously, you're not necessarily going to be testing people's hearing. If there really is an issue with hearing, you're going to send them to audiologists to hook up the stuff and get a hearing aid or whatever they need it. But we're going to, we're going through all the different cranial nerve tests so that you understand the tests. In reality, you may not be doing that. But it's possible, though, that you may be treating somebody with acupuncture that has hearing problems, and you want to have a simple way to assess their hearing to compare one side to the other. Let's say if you notice they can't hear as well in one ear, that as you're moving it away, that this ear they stop hearing it at this point, and then the other ear they can hear it all the way up to here. And you do some kind of treatment, then you can compare it. So it makes sense to have some simple way of just assessing their hearing on a basic level. So what conductive deafness is basically is that it's the stimulus is not getting transmitted to the bone. Okay? So it could be some type of obstruction or wax buildup, or the tympanic membrane is not functioning properly, or a middle ear obstruction. So somehow the sensory impulse is not getting to the bony conductive part. And then you can have sensory neural deafness where there's a problem in the actual nerve component of it. Okay? So that's more stuff that's deeper on the inside. So that could be Meniere's disease, drugs, or noise damage, things like that, vascular or demyelinating problems. The nerve or sensory neural has to do with the conductive system deep inside the body, versus conductive is where it's just not getting into the part where it's vibrating the bones in the middle ear or the inner ear. And so then Meniere's disease is progressive loss of hearing. You can have tinnitus. You know what tinnitus is, right? Ringing in the ears, nystagmus, vertigo, nausea. And then vertigo is a sensation where the environment is rotating. You can have I think it's called subjective and objective, where one is where you feel like you're spinning, and the other one is where they feel like the room is spinning. So there's a little bit more difference in vertigo. And then dizziness is unsteady or So now going into number 9, which is the glossopharyngeal nerve. So that's a mixed one. It has motor and sensory. And then also has autonomic. So it's going to innervate some of the muscles in the anterior part of the neck. And then this is going to pick up the posterior 1/3 of the taste sense of the tongue. Okay, the anterior part was the other one, and then this is the posterior third. Anterior was the facial, right? Yeah. Facial is motor to the face, and then anterior 2/3 of the tongue. And then sensory is posterior 1/3 of the tongue for the glossopharyngeal. And then it also has parasympathetic innervation to the parotid gland. So then the vagus nerve is part of this nervous system that's going to go through all the internal organs. So it's motor to the muscles of the pharynx and the larynx. Okay? But then it also has sensory in those areas as well. So it's sensory in the mouth and throat, pharynx and larynx. And then basically it's going to do parasympathetic function to all the internal organs, digestive organs. And basically everything in the thorax and the abdomen. If you trace the vagus nerve, I mean, it's coming from up in the cranium, it's going to go all through the internal organs. So to check the vagus nerve, because again, it's going to do muscles of the pharynx and larynx, so you ask the patient to cough. So you did that a little too early, whoever was coughing, weren't on cue there. So basically, it's going to move the vocal cords, so that's the motor part of the vagus nerve. And then you ask the patient to swallow. So again, you're moving the muscles in the pharynx and the larynx. And then hypoglossal nerve is a motor nerve that innervates the muscles of the tongue. And then basically you're going to use the gag reflex, and that's a way of testing a couple different cranial nerves. Okay, so it's going to test the glossopharyngeal, which is number 9. And then you're using the vagus nerve. Okay, so that's basically when you're taking the tongue depressor and you go back into and touch the back part of the mouth back in here, and they're going to have sensation of gagging. Okay. Then that's going to, the tongue will deviate depending on what the lesion is. And then you're also, when you stick your tongue out and say ah, like that, you're checking for the hypoglossal nerve, the 12. Okay, and so they're going to deviate towards the side of the lesion. So when your tongue's going out like this, if I have a lesion on this side, these muscles aren't going to work as well, so the muscles on the other side are going to overpower it. So if you're sticking your tongue out and say ah, you're watching for the back part of the pharynx and larynx to go up like that, and then you're looking for the tongue to go and you're looking for it to deviate from one side to the other. So the muscles that are working normally are going to work harder, and they're going to push like this. So the muscles on the left are working harder than the ones on the right aren't working. They're going to deviate towards the side of the lesion. And then the vagus nerve is going to do motor to the muscles of the pharynx and the larynx. So if you have a problem with that, then the uvula, which is the little part that hangs down here, that's going to deviate to one side if you have problems on one side of the vagus nerve. And then spinal accessory nerve, we mentioned that a little bit when we were talking about the cervical plexus. That's the one cranial nerve that's going to innervate muscles of the neck. Okay? So the way you're going to do that, you're going to test, it does the sternocleidomastoid and then also the trapezius. So you can have them shrug the shoulders like that. Okay, so you're going to press on the shoulders like that, and you're going to say, I want you to raise your shoulders up like that. And then the SCM, if I contract this SCM, what's the head going to do? So there's a couple different things. It does rotation. Does it rotate? So when we say that when it goes to the same side, we call that ipsilateral rotation, if it goes to the other side, then it's contralateral rotation. So if I contract on this side, is the head going to rotate towards or away? Away. So it's contralateral rotation. And then what's it going to do for lateral flexion? Is it going to be contralateral or ipsilateral? Ipsilateral. Like this? Ipsi. So ipsilateral lateral flexion, contralateral rotation. Right. So then you're going to have the patient hold like this, and then you're going to try to pull the head back the other way like this.